Not enough bone in the upper jaw to stabilize an implant because the sinus space has grown too large, a process known as pneumatization. In order to be able to restore the area with dental implants, there will need to be bone added between the upper jaw and the sinuses. This is a minor procedure called a sinus lift or sinus augmentation. The gum is lifted on the side of the teeth, and a small window is made to gain access to the membrane lining the sinus. The membrane is carefully lifted up and away from the jaw. Bone graft material is placed into the newly created space previously occupied by the sinus. It is then covered with a small membrane. The area is sutured closed, and bone is allowed to grow and integrate. Duration of integration may vary from as little as 4 months to as long as 9 months, after which dental implants may be placed to restore the area with new teeth.